Hi, my name is Terry Kuti. I am the founder and director of Deep Sea Foundation. I'd like to welcome you to our educational channel where we discuss all topics related to breast cancer and breast reconstruction. I'm really excited this morning. I'm joining virtually, but my guests today are at the World Urban Forum. It has been called WOOF 11 on social media. It's really a fantastic conference and kind of wrapping up for the next 24 to 48 hours, I guess. I am with Team Toliman, Team Shared Decision Making, Team SDG, Team WIS this morning. I'm going to introduce each of them, and you can just raise your hand in acknowledgement when I say your name. So first of all, I want to give a little bit of background why I wanted to do the interview this morning, because Deep Sea Foundation is a patient advocacy partner with Breast Advocate, and we are going to be talking to the founder of Breast Advocate this morning. And our missions are aligned as we strive to empower patients, encouraging and insisting users of the app to understand the value and importance of shared decision-making, which has been a huge topic, I know, with a lot of the interviews that you all have been doing this week. So without further ado, I'm going to say each of your names and I'll let you give a raised hand so we know who you are. First of all, I'm talking with Santiana Chrysopoulo. I'm talking with Federico Halperin. I'm talking with Dr. Minas Chrysopoulo. And also I'm talking to Gareth Presch this morning. So Dr. C, I'm going to let you start and just tell us what has been the focus of your participation at WOOF 11 as the founder of Breast Advocate, as the CEO of Toliman Health. I mean, what have you taken from this conference this week? What's the purpose of you even going? And what's your hope for the future based on everything you've learned and participated in this week? That's a loaded question, right?
So that's a loaded question, but also the best question to really start off with, because the underlying message that we got from this is really we can help improve patient access to education, directed education, which that's what we're about. It's the ideal opportunity for shared decision making. And really what's been phenomenal for us has been to listen to the pain points of different cities, different nations, actually, and try and find really the sweet spot where we can improve patient access in a culture-specific way, right? Because what works in the US obviously is not going to work everywhere. And so here we are bringing tech and an app that's working very, very well, specifically for breast cancer. Now we're talking about customization, white labeling, really customizing the way we present the information and the user experience to tailor the information delivery and the way patients prefer to access their healthcare teams based on individual regions, cities, and even countries. So we've had a phenomenal conversation with Tunisia, 44 cities. So really very exciting, very eye-opening too, because we take so many things for granted in the US, and the issues we have in the US in terms of access, though very real, are also very different to other parts of the world. So it's been really absolutely phenomenal.
So, Gareth, you've been doing a lot of LinkedIn Lives interviews and broadcasts. So in terms of the city mayors, in terms of all of the global leaders that have been there, what are you hearing from them? And behind you, there's the sign, the SDG cities. Okay, so this is a sustainable development goals from the United Nations. So speak to us a little bit about, you know, what you have seen from the city mayors and what information has ignited them that they've taken away from this conference.
So the message here would be that we are behind the targets. So like in terms of the 17 SDGs, the 169 targets, I think the message is that we've got a lot of work to do, but that creates a lot of opportunity. I think like, from a healthcare perspective, I think the message is starting to see through that we need to move to prevention at scale. I think that's what's the overwhelming message. And also to look at it from the point of view of value creation. I think we had the business assembly meeting with Alan Toliman, the mayor of Presch, and the SDGs that was established. I think the overarching theme is that people want to move to prevention. Also support the health system under enormous pressure. So that would be my kind of underlying theme, should we say, or overarching theme from the healthcare's perspective. And also, I think it's so great to see the diversity in the room. I mean, working with city planners, like our curator today, that webinar that we held, fascinating to see the link between sandstorms in the Middle East and health and well-being, for example. So respiratory disease and, you know, the effects on the health service. So I think we see that, you know, there's a team right across the 17 SDGs that are related to health. That's a big opportunity for ourselves.
Yeah, I really like the prevention aspect of this too, that I heard from you. I think that's going to be a cost saver for the health system. It's going to be something that is, you know, that we can focus on with patients for long-term healthcare and prevention. So I like that aspect of it. Yeah.
Actually, we've been trying to go across here, not so much cost saving.
Yes.
Yeah. So, for example, even with the sandstorms that we're seeing in Kuwait, they actually close the economy. They cause car accidents. They cause fatalities. All of this is a cost, right? But also it stifles value creation. So it actually stops their economy. So that's what we're trying to do. Why and how do you put in these you know, mitigation? How do you stop these things happening? So actually allow people to go to work so that they don't crash their car. If they die, then they don't pay any taxes, for example. So we're trying to look at that from a preventive perspective, which creates economic wealth.
Yeah. Yeah. Well, I'm going to segue now. I'm going to go over to Federico, because there's something you have been talking about in terms of the Breast Advocate app and also the work that Toliman Health is doing in digital health. You used a word called gamification, and I don't think everyone understands the value and benefit of that. So for the listeners, Federico, can you talk to us about how that kind of weaves into digital health and what the true value of it is? I understand it. To me, it is just a spot-on way of engaging the user, but I'd like for you to explain it to the listeners if you could.
Yeah, absolutely. So basically, gamification is a concept where you need to find a way to motivate users to go through certain flows within the application and to get certain things done to achieve that we as a platform are looking for, right? So it's a concept that is not new, of course, and there's a lot of applications. Even social media applies gamification concepts. This whole idea of constantly having to scroll to get new content is a way of gamification to see what's going to come next. So there are a lot of applications of gamification of what we are trying to do that we already knew about. And as Minas and Gareth were saying, we take some learnings from this conference as well. We had an awesome panel this morning where we were talking about the motivation aspect, right? Because you can have the best application, you can have the best strategies, but in the end, it's all about having users use the app, right? there's no point in having the best app in the world if nobody uses it or nobody is motivated to do what they are supposed to do to get the value out of the platform. So gamification can be applied in many ways to what we're doing. One of the things that we were discussing with Tanisha, that Minas just mentioned, is the fact that the elderly population, especially in those countries, in those cultures, rely on youth a lot for them to help them navigate the system and for them to help them get the screening and get the prep work done. So we really need to motivate these helpers for the actual patients to get engaged with the app and to get engaged with the experience. So we are thinking about a mechanism to reward people that take care of the elderly and get things accomplished with them in exchange for rewards that can take any form. It could be a governmental initiative where they get, benefits from the government. It could be points that could be exchanged for products. It could take many forms, right? But the whole concept is this idea of using an app as if it was a game, right? And that you get a reward, you either get to the next level or you get something in return based on your engagement with the app. That's the concept.
Well, I can tell you as a longtime educator that motivation is key to keeping, everyone engaged. And from my standpoint, students in the classroom, motivation is very important. So thanks for explaining gamification to us. So I'm going to hand it over to Santiana now. And Santiana, you have been the voice and eyes of youth at Wolf 11. And I've been watching you, taking care of the social media events there, but also, what has this mean to you? You're a college student now, and as the eyes and ears of youth, this is what kind of inspires and ignites me for our future. What did you learn and take away from Wolf 11 that you see your generation working on in terms of digital health, or even, what do you see the benefits of this for breast advocate too?
Obviously, now is our future, so especially being here and seeing all of the countries, different cultures, and everyone being connected in this way, really shows, I think, the importance to it all, and all of us being kind of united from every part of the world, and I think it's even more important for the youth to do the same and kind of unite and connect with each other in the same exact way, including here. And going to future of breast advocate, in particular, I think the whole implementation aspect of it, like we were talking about earlier, is definitely very hard to because everything is digital now, especially for the back to the situation, for example. Talked about how every young person from teen to older, they're all Facebook and documents are digital, their whole lives are online. So to put all of that for everyone, everyone see all over the world, and they can make great impact in the whole gamification thing, since everything is digital. Especially success through the new work, our minds are now trained to work very quickly, and it's important to keep it engaged since everything is minds are kind of at that higher level to keep up with all the technology. So I think it's definitely important.
Well, we're just going to try really hard to keep up with your excellent and nimble minds of your generation, and we're going to follow your lead. So I will wrap it up with Dr. C. What's your hope for the future after being? This is just has to have been a wonderful experience for all four of you And I'm just so appreciative that, I've been able to join you virtually. What is your hope and biggest takeaway from Wolf 11, the World Urban Forum in Katowice, Poland this year?
See, right now, Terry, I'm still trying to process everything.
Mm-hmm.
It's been very surreal. I never in my wildest dreams imagined that Toliman Health would be on this stage and have the opportunities to make such an impact.
Mm-hmm.
So really, it's a mix. It's a combination of being one part blown away, overwhelmed by everything. Another part of me is really humbled, and I feel seemingly privileged to see having opportunities to try and make an impact with what we've learned already. On a personal level, being able to meet everyone face to face for the first time. I mean, it's the first time I've met Gareth. We've been talking about years. I mean, we've been talking about the woes of Manchester United and all that kind of stuff. And finally, we get the opportunity to have a drink together, and connect, and he's every bit the person I thought he was. So that's always great. Spending time with Fedi, Chief Tech Officer, but it's the first time we spent time together. I mean, it's really incredible. And saving the best for last. Having Ghana here, as a father, being able to share this with her. I'm exceedingly proud. I can't even describe how proud I am. The work she's put in to help us prepare, and also really not just holding our own, but and then some. You're talking to delegates from nations, right? Because we had to kind of divvy up roles because it's been, pretty much full go. And so feeling that you can entrust your own child to man your group while you go off and talk to mayors and delegates, I've been in awe of her, and so really it's been absolutely amazing.
Well, she has a very good mentor. Gareth, you headed back home. You have been everywhere are you headed back home to the UK to see your family?
Yeah, I'll be heading home on Friday, and then I'll have a few days to recover, but we start again Monday, we go again Monday, but the following week then I go to Sarajevo, and then to Vienna. So it doesn't stop. As I said, we've got a lot of work to do. I think we've probably we launched the SDGs. So now it's really, we start to exchange and the projects start happening. So we really have to get our hands dirty. That's what we need. People like Vanessa, yourself, Federico, Santiago. We need everything behind this. We've got a big job ahead. And I think we can only do it collectively. We can only do it as a collaboration. What I've really enjoyed about this week has been able to bring all of us together and have a common goal and realize that we have to take shared decision making. We've got to take the shared responsibility to help each other. And that's the only way forward for me. No one platform can provide all the solutions. We've got to be able to work together. We've got to be able to create together. We've got to be able to share together. So we've got to be able to leave no one behind. That's the goal here. And we need leadership. And that means we've got to do some hard things. We got to get around the world. We got to make things happen. So I feel extremely privileged and grateful for the opportunity that you made the SII Foundation to give me the 25 series. We care for the UN Habitat. We met the mayors, we met the senior officials. But I think in conferences, it's always what happens next. And I think really it's down to make sure that we actually stay and that we deliver on the SDGs. So I'll be the as you say, to meet people personally. It's just fantastic that I feel really grateful to meet you guys in person. Shared stage because you're a friend and I'm trying to do the right thing for this great business. We're also friends, and Robin says no friends have friends. It's so true. I think that's the best way.
Yeah, I think when people see these conferences online, it's a bit overwhelming to them. It seems kind of like a big show. But here's what I know, because it's happened to me this week. I've been attending virtually, and you connect with people. And I always say one person at a time, because those ripples, Santiana, don't forget this when you go head to college, one person at a time, because the ripples, you have no idea how that can affect such a greater community. So you guys, thank you so much for joining me today. Safe travels home to all of you. This has been very enriching for me. And I'm going to see if I can get my sleep schedule back on normal hours. I have loved listening to you, even at 3 o'clock in the morning in Seattle. It's been fantastic.
Thanks, Harry.
All right. Thanks.
Thank you. Thank you, Harry.